Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing how to perform urinalysis. So in this video we shall be learning how to perform the urine analysis or urine dipstick. So before you start the procedure, first you do general hygiene, that is you clean your hands, you apply or you wear the disposable sterile gloves. Then what you do, you introduce yourself to the patient, you gain consent for you to continue the procedure, and you explain the importance of doing that procedure to the patient. Then the first step is you have to gather all the necessary equipment. For example, you may require a urine test strips. So this is the urine test strip. So you will require a urine sample, that is a labeled bottle. So you will require a paper towel for you to clean your hands or the surface. So you will need a phone or a stopwatch for you to count the seconds when you are doing the procedure. Then what you do first, you gather all the equipment, that is the necessary equipment, that is the urine strip, the sample urine that is well labeled, and a paper towel or a tissue. Then firstly, the second step is you have to check the strip first. So you have to check the strip. So you have to check the expiry date of the strip. For example, our expiry date is 2025 April date 13. So it is not yet expired. So first you have to check the expiry date of the strip. That is very, very important. Then what you do, the second step is first you also check the urine sample. For example, it should be well labeled. For example, it should have full name of the patient, sex, date of birth, residency. So you have to check the urine that is well labeled. Then what you do, then you start by inspecting the appearance of the urine. So you start by inspecting the appearance of the urine. So a normal urine will be pale amber in color, that is pale amber in color, so that is straw colored. So a well urine is pale amber, deep in color, so this is a pale amber. Then you have to check the changes in color. For example, if it is dark, so if it is dark in color, it may indicate a jaundice. So if it is red in color, it may indicate blood in urine. That could mean there is a kidney damage or bladder stenosis or bladder damage or kidney stenosis. Then what you do, you must also check the turbidity, that is if it contains foreign particles, that is sediments. So you have to check first. So the urine should be very clear that there's no any visible particles inside it. Then after you have done all that, then what you do, so what you do, you start by opening the strips. So you open the test strip first. So you open the test strip, then you remove one test strip, so avoid touching in the square colored area. So you avoid touching in the square colored area. So what you do, you replace the cap of the test strip to avoid deteriorating the test strip. Then what you do, so you place it horizontally on the working bench. Then what you do, you open the urine sample first. So you open the urine sample, so you place the cap on a bench. Then what you do, you immerse the test strip fully into the urine. So you immerse the test strip fully into the urine, deep into the urine. This is how you are going to do. So you immerse it. You immerse deep into the urine. Then what you do, so what I should do, I should place a paper towel on my working bench. So for example, I place a paper towel on my working bench. Then what you do, after you have inserted the test strip deep into the urine, so you place it horizontally, you place it flat on the working bench like that. Then what you do, you close the urine sample. So you close the urine sample. So you wait for that. For example, for glucose, protein, and blood, you wait for that seconds. For example, then what you do for glucose, so that is glucose and this is protein and blood. So for this you can wait for that seconds for you to read the result. So the rest you can read after 2 minutes. Then what you do after you read, you get the test strip and you compare your results on the test strip container. So you compare your result like this, you hold it horizontally, you compare. So if there is any change, it may either be a positive that is maybe mild, or a positive that is moderate or severe. So then you compare your test result, all this. For example, the first one we have is bilirubin. So the bilirubin is a bile pigment, it's a bile product of the liver. So if there is a bilirubin positive, that could indicate a liver problem. We also have UBG. So UBG means urobilinogen. So urobilinogen is indicates liver iron problems or liver disorders. We also have KET. So KET means ketones. So we use ketones to check for diabetes ketoacidosis. So we use for ketones to detect for diabetic ketoacidosis. We also have GLU. So GLU means glucose. So if there is a glucose in the urine, that could indicate a diabetic. We also have protein. So if there's increased level of protein in the urine, it could indicate a kidney damage, a heart failure, kidney stone, or kidney infection. So we also have blood. So in case if there is blood, that is hematuria, blood in the urine, if blood is positive, that could indicate there is a damage in the kidney, or there is a kidney stone, bladder damage, or bladder stones, a kidney cancer or bladder cancer if there is a blood positive. So we also have NIT. So NIT means nitrate. So if there is a nitrate, it could indicate a bacterial UTI, so that is a urinary tract infection. We also have BH. So BH measures the acidity and basicity of a substance. So if there's increased level of acid in the urine, that could mean there's a kidney infection or there's a urinary tract infection. We also have specific gravity. So SG means specific gravity. Specific gravity measures the concentration of urine. Maybe if there is a higher than normal concentration, so the patient drinks or consumes less amount of fluid. So we also have Leo. So Leo means leukocyte. So if there's a presence of leukocyte in the urine, if there is a leukocyte positive, so this could indicate a bacterial UTI. So this could indicate a urinary tract infection. So then what you do, you start by recording. After finishing comparing your results in the test strip, then you start by recording your results in the laboratory request form. So let us wait. Let us now compare the result. Let us compare the result now. So let us look now. So what you do, you compare your result in the test strip like this. So do you observe any change? For example, we have the specific gravity a bit change. So in the specific gravity we have here, so this could indicate the concentration of urine. So specific gravity is positive, leukocyte is negative, so BH is normal, nitrate is positive, so blood is negative, so protein is somehow positive, so glucose is negative, ketone is negative, urobilinogen is negative, and bilirubin is somehow positive. So now we shall do how to record them. So this is how we are going to record the test results. So this is how you are going to record your results. For example, in the laboratory request form you write, so lab report. For example, you write lab report for urine analysis. So you write in your laboratory request form lab report, then you write urine analysis. Then this is the result. For example, when you are writing, this is how you are going to write. So you can write, for example, bro, that means protein. You can write 1 plus. So 1 plus means mile. So this means mile. So if you write 1 plus, so this is a mild condition. So if you write 2 plus, this means a moderate condition. So this is a moderate condition. So if you write 3 plus, so this means the condition is severe. So this is how you are going to report the lab result. For example, in your lab report, a urine analysis. So for example, you can write here bell amber. You can write the appearance of the urine, bell amber. Then in your result, you write what you have found in the test strip when you compare the result. For example, if protein is positive or negative. So if it's negative, you can write nil. You can write nil, or you can write not. You can write not, or you can write negative. But in other words, when you're reporting for positive, you can write, for example, if I say here this is nitrite, you can write 1 plus, or you can write 2 plus, that is mild, and this is moderate, or you can write 3 plus. So this is how we're going. So you record everything, for example, if it is positive or if it is negative. So this is how you are going to interpret, or this is how you are going to perform urine analysis, and you can easily interpret the results like this, and this is how you are going to report the results. So thanks for your watching. Have a nice day.